If you have a toothache when you're at home, there's different ways that you can manage it. Try and take some painkillers, and try and take them regularly as instructed on the packet to try and keep the pain to a minimum. Try and have a softer diet, so try and avoid anything hard, cold, too hard or too cold, too sticky, or too crunchy. So stick to things like bananas, soup and bread. To try and make it easy on your teeth, and keep up with your oral hygiene as well. So brush and floss your teeth as you would do normally. Quite often keeping a clean mouth helps to reduce the bacterial loads inside your mouth, so that will help to reduce any pain as well. When you are sleeping, try and sleep on a pillow so that less of the blood rushes to your head, so that reduces the pressure inside the tooth to reduce the toothache as well. There are certain gels that you can use, such as benzocaine gels that you can apply on the gum next to the tooth, or if it's an ulcer, that will help to reduce the pain. And also try sort of mouthwashes, such as Corsadil mouthwash, or sometimes a Fluorogard mouthwash, or even salty water mouth rinses, where you take a teaspoon of salt, mix it with lukewarm water and rinse your mouth out with it. Common causes of toothache can be a dental cavity, dental sensitivity, or maybe an abscess. It's very difficult to say which one you have until you go and see your dentist. It may be, when you look at the tooth, it may look fine. So you may have something like a cracked tooth syndrome, where the tooth has got a little fracture or crack inside it, which also causes pain on biting. So it's very important to go and see your dentist to get a correct diagnosis for your toothache. If you find that you have problems breathing, you cannot open your mouth more than 2 centimeters apart, you have problems swallowing and speaking, then do contact either your GP or your dentist, because you may need an emergency appointment. If it's out of hours, then you may need to ring 111 for advice as soon as possible. The most common types of tooth pain that you can have are sort of a sensitive tooth pain due to tooth sensitivity, that may be due to a dental decay or a cavity inside. You can have a dull throbbing pain if you've had an extraction done or an ulcer, or you can have a very intense pain if you have an infection. Sometimes you can get swelling inside the mouth, which you can see in the face as well. We'd recommend that you see your dentist as soon as possible when you have a toothache, to try and find out what the problem is and give you the best advice and options for treatment to try and help you. Gum disease and infection can also cause aches and pains inside your mouth. It can be a very intense pain and very sensitive. You can get abscesses due to gum disease as well, and certainly they can cause loose teeth and other problems with teeth as well. If you have a dead tooth or an abscess, you may notice symptoms of a continuous dull ache that doesn't go away and sometimes gets worse at night time. If you do get to go to sleep, it may actually wake you up at night time. So it's an irreversible pain that you would have with an abscess or a toothache. For example, it may be sort of a very intense pain while you're eating something. It may dull back down, but it usually wouldn't go away. If you find that your cheek or your jaw is swollen when you look in the mirror and you have any difficulty opening, or you have any difficulty swallowing, then ring 111 or your dentist for advice straight away. It may well be that you need some antibiotics to try and help that swelling go away, and you may need some further treatment on the tooth, like an extraction or a filling. If you have tooth sensitivity or toothache, you can rub some of the desensitizing toothpaste next to the tooth. So take a pea-sized amount, put it on your finger and actually rub it on the tooth, and you can actually leave it there overnight for the fluoride in the toothpaste to leach into the tooth and to help it become less sensitive. If you have swelling on the area or you have toothache, you can use a cold compress on your jaw next to the toothache, and that may give you some relief. If you have toothache, you can apply clove oil to the area where the tooth is sensitive or painful. Do be careful of applying too much and leaving it there for too long, because sometimes it can burn the gum and then you may end up with an ulcer. So certainly don't put any aspirin or any tablets or anything into your gum next to the tooth, because that can become painful by causing sort of sores and chemical burns inside your gum. There are several over-the-counter antiseptic gels such as Curacept, Corsadil, gingiva gel and oral gel. All of these can help to give you some temporary relief. If you buy a gel over the counter, you can take a pea-sized amount on your clean finger and rub it onto the gum itself. And the idea is to have a wet finger and try and dry the area as much as possible, because you may find otherwise it ends up sticking to your finger itself. So apply it next to the tooth, the gum next to the tooth, and just leave it there. But essentially, you must go and see your dentist to find out what the problem is so that you can cure it. Once you have a toothache, we would recommend that you avoid eating anything sugary, anything hard, sticky or too hot. Try and have soft foods, try and take some rest as well, and try and keep up with your painkillers. Do not overdose on your painkillers, so make sure that you follow the instructions on the packet as to how many painkillers you're meant to have. Depending on what kind of relief that you have, it may be temporary. So if you have a painkiller, it may be a couple of hours, or if you have a salty water mouth rinses, it may just be while you're rinsing your mouth. So depending on what kind of pain relief you have, you may have sort of different amounts of time that it works for you. But essentially, if you go and see your dentist, they may be able to help you with what the problem is. For example, if you need a filling, then they may be able to do that for you so that you don't have toothache anymore. If the pain goes away, then continue with really good oral hygiene. Make sure you still go and see your dentist, because you more than likely will still have a problem there, and continue having a soft diet and avoid any sugary foods as well. You can help to prevent tooth pain by having a good diet, by brushing and flossing your teeth, and having a very good oral hygiene routine, and visiting your dentist regularly.